What's going on, guys? It's been a while since I've made a video, and the topic is going to say it all today. Let's talk about two different things. Um, One that I don't ever really hear about being discussed very often, in a manner that sheds light on the subject. That topic is steroids in Brazilian Jiu-Jitsu today, or steroids in general in martial arts. Do they have a place? Is there a purpose? Is there a benefit? All that shit. Um, so that's kind of a taboo subject, and I want to talk about that a little bit. The other topic is what I believe to possibly be a fast track to getting yourself successful at Jiu-Jitsu, to help yourself learn the art of Jiu-Jitsu faster, and to help you get to where you want to go. It definitely won't be the finish line because there is no finish line, but just something you can do. So let's talk about the first subject: steroids in Brazilian Jiu-Jitsu. You're seeing it now all the time in the IBJJF tournaments. You're starting to see in a lot of organizations they're saying they should test, which really that's kind of a hard thing to do since anybody off the street can go into a tournament and whatever. And the thing is, nowadays you have so many people over the age of 35 on TRT or HRT, which is testosterone replacement therapy, or hormone replacement therapy, which usually, and I'm no doctor, so I'm not going to act like I know all the answers, but hormone replacement usually means they're doing a combination of growth hormone and testosterone. Definitely a way more expensive route to go compared to just a testosterone base type of steroid. This is brought to you by my new vaporizer. Stay vaping, my friend. I don't smoke tobacco, so in case you're wondering what's in that, it's not nicotine. So let's look at this in two sides, right? What's the benefit to using a steroid in Jiu-Jitsu? Well, what's the benefit to using steroids in general? A better sense of well-being, health purposes, different things like that. Granted, if you're a guy my age, you will benefit in that manner, right? You can Google this shit and a bodybuilder can tell you better. But what you have to understand is most of the time, I would say, if any of these guys that know what they're doing at the higher level guys, they are not taking bodybuilder doses. This would be my guess. This is just a guess. And believe it or not, I do have some experience in this. I would say they are more on the therapeutic range. Therapeutic range meaning they can recover faster, they have less fatigue, their body can utilize oxygen to the muscle better, they might run the risk of elevating their blood pressure, but also increased aggression. So let's talk about that for a second. In a sport, let's say sports side, sometimes being aggressive will help you get to the finish line faster. So that sounds good, right? Being aggressive will help you probably win a match because you're not going to quit. You're going to turn into a pit bull and you're going to want to get it done. I'm not talking about the 55-year-old who's on a very mild TRT dose of like some testosterone cypionate at even 100 milligrams a week. I'm not talking about that. I'm talking about a 22-year-old who's taking around 200 milligrams a week or every 7 days. Some are taking twice, which if you're doing that is probably more than enough. It's more than you need for a therapeutic dose to help you improve your game in Jiu-Jitsu. I shouldn't even say that because it's not going to improve your game, and I'm going to tell you why. If you are a world-class Jiu-Jitsu practitioner, just like if you're a world-class bodybuilder, taking a steroid will just help you stay where you are. You're not going to be a fucking loser, take a steroid and become Arnold Schwarzenegger. Or you're not going to take a steroid and become the best at Jiu-Jitsu. It just doesn't work that way. Okay? I don't even want to accidentally drop any names of high-level guys because I'm not going to relate them to steroids. But if you think about some world-class guys, right? Either way, they would have been world class whether they use shit or don't use shit. It's just, could they win? Probably not. It's like in the world of bodybuilding, which is a little bit more familiar from when I was younger and I was into this stuff. You take the top 10 guys. They're all on fucking gear. Now, if you were to take away steroids altogether, those top 10 guys would still be the top 10 guys. It's just nowadays you have to even the playing field. It's just like the UFC nowadays. Why fighters are getting busted? They're all fucking taking it. They just know how to get it out of their system. They're all taking esters that disappear fast, so it's not staying very long acting in their body. And there's tons of shit out there nowadays. There's designer stuff. There's stuff that like blows my mind. It's not even like, there's different peptides or different SARMs, I think they're called, or SERMs. Right? I don't even get into that shit. But let me go back to that for a second with the increased aggression, right? Here's where problems occur. Most times when you train with a guy who's always aggressive, you almost can tell his technique almost just sucks, but he's just so aggressive, he always wins, right? He's just so aggressive, he'll hold you and just do this. So here's my experience, okay? Nobody else's, just mine. When I'm not taking anything, right, I'm a lot lighter. I'm a lot more flexible. And the reason I talk about this is if you look at some videos earlier on, you'll see when I first started doing videos, I was a certain size. Then I started doing videos and you saw me on a cleanup period, I'll call it. I was a lot smaller. Right now, I am going into a transition where you will start to see my size increase. I'm not going to say why, but you fucking are intelligent enough to figure it out. My size will increase. What I've discovered in my experience, and Cron Gracie once talked about this in an interview or something like that, and it's so true, so I'm sure I'm not the only person. What happens is when you take, let's say, a testosterone or an androgen or anything, it's going to make you feel more alpha, right? So you're going to start feeling like, fuck this guy for trying to push me around. Yeah, I know how to play the game and let him try to feed into me, and I use all my technique to stop him. But now I'm starting to feel a little bit more Brody. So now I might start stepping out of my comfort zone. I might start gassing myself more because I'm just going to muscle the fuck out of you. You don't push me around. And that's the downside. The downside, if you don't get that in check, is you could be fucking super technical, but sometimes your ego will start inflating again. Something that took you so long to get in a check, you start to lose control of, it inflates, and before you know it, you're being really aggressive, really competitive, you just don't want to lose, you don't want to give up a position, so you almost stop yourself from being successful at Jiu-Jitsu. Because Jiu-Jitsu is the gentle art. You must always keep in your mind that I am the weaker, smaller person, even when you're not. Because that will always keep you surviving. And the problem is once I step out of that comfort zone and go into, let me show you what the fuck's up, I'm breaking away from the elements, the laws of Jiu-Jitsu, right? And now it works for some people and they become super successful that way. You watch their tournaments, you watch certain videos, and you know who these people are. You can look at them and just tell their moves are always the same. Always the same. You know exactly what they're going to do. A lot of times, though, you can't stop it because they're so powerful and aggressive, right? Nonetheless, these guys are still top guys either way. You know, I'm not taking anything away from that. So, this is going to have to turn into a whole series, you know, because nowadays it's becoming more to the surface. So, if you're an older guy and you're past your 30s, you're in 35, and you want to talk about TRT, we can talk about that. That's legal through a doctor and through a pharmacy. You want to talk about drug profiles? We can talk about it. You want to talk about, does it actually have a place in your training? Will it help improve your training? It's not going to make you a fucking stud. I can't just look at a bottle and say, make me better. It just doesn't work that fucking way, right? And the reason I'm kind of saying this too is for that young guy who's 18 or 19 and he's competing all the time and he wants to be the next world champion. You might be the next world champion even without it. Don't sell yourself short. But also don't think that it's going to be a shortcut to get you to that world champion, to get you in the Gracie magazines, to get you all over the place. It's not going to do it. But I'm not going to lie. It's going to definitely improve a lot of fucking things. I'm not going to lie. But there's a lot of things that, you know, in our world, it's very new to us. You go to bodybuilding, they can fucking teach you everything. The problem is they're going to teach you how to use those chemicals towards their sport. But it's two different things. Shit, if I take half the stuff they're taking, I'll have a heart attack on the mat. If I even take, let's talk about something like Trenbolone, right? That's like the god steroid for bodybuilders, supposedly. Dude, if you took that shit, you'd fucking have a heart attack. You would